Hey Arcanites, here's a question. How often do you reach for antacids when your heartburn or acid feels off? They're super convenient, but overusing them comes with risks that most people don't talk about. Today, we'll go through 5 potential side effects of overusing antacids, why they happen, and how you can use them more safely. Let's get into it. First, a slight refresher on what antacids are. They're over-the-counter meds used to neutralize stomach acid and relieve symptoms of heartburn, indigestion, and acid reflux. They contain ingredients like calcium carbonate, magnesium hydroxide, aluminum hydroxide, or sodium bicarbonate that raise pH in the stomach. In moderation, they're usually safe. But when used frequently or in high doses, side effects can emerge. With that out of the way, how about we see those side effects now? Like constipation. Antacids with calcium, as an example, calcium carbonate, like Tums, or aluminum tend to slow bowel movement, causing constipation, bloating, or gas. If you already struggle with low fiber or dehydration, this can worsen things. As a tip, if you have to use those antacids, ensure you get lots of fiber, fluids, and consider switching to alternatives that don't constipate as much. Next is a rather messy one, diarrhea. On the flip side, antacids containing magnesium, like magnesium hydroxide, milk of magnesia, can have a laxative effect, leading to diarrhea, stomach cramps, or nausea. This is more likely if you're taking high doses or use them frequently. As a recommendation, watch your dose, and if you switch between types, magnesium versus calcium, balance to reduce extremes of constipation or diarrhea. Leaving aside the gross side effects, let's go with the less gross ones, but arguably worse. First, we've electrolyte imbalance and mineral disruption. Overuse can upset the balance of minerals in your body. Too much calcium, magnesium, aluminum, this can affect your heart, bones, kidneys, and even nerve or muscle function. For example, hypercalcemia, high calcium, can cause fatigue, confusion, muscle weakness. Chronic aluminum exposure from antacids has been linked to bone demineralization. Aluminum interferes with calcium and increased fracture risk. Here's a tip for you. Don't rely on antacids as a staple. If you use them regularly, get your mineral levels monitored, and ensure your diet supports mineral balance. As I said, mineral disruption also causes issues in the kidneys. Among them are, more specifically, kidney stones and renal stress. This happens from too much calcium from antacids, especially if you've already got calcium supplements or dairy. They can increase the risk of calcium kidney stones. Also, your kidneys have to filter out excess minerals. In people with kidney problems, this extra burden can be harmful. A tip for you: if you have kidney disease or a history of stones, talk to your doctor before using antacids regularly. Use lower dose options when possible. Last, and, unfortunately, not least, we have osteoporosis. Overuse of aluminum-based antacids may impair calcium absorption long-term, weakening bones and increasing fracture risk. This happens because aluminum can bind with phosphate in your gut, reducing phosphate absorption. Phosphate is essential for bone strength. A quick tip: use aluminum-free antacids when possible, or rotate types, and make sure your diet gives you enough calcium and vitamin D. Thankfully, not everything is all gloom and doom. If you still want relief, here's how to use antacids more intelligently. Use them occasionally, not as a daily crutch. Choose the lowest effective dose, and don't exceed the recommended amount. Space them away from other medications. Many drugs interact. A 2 to 4 hour gap is often recommended. Address root causes, diet, weight, acid triggers, instead of just masking symptoms. If your symptoms happen more than twice a week, see a healthcare provider. You may need stronger acid therapy or testing. So, antacids can bring fast relief, but they're not without cost. Use them wisely, monitor your health, and don't ignore recurring symptoms. If this helped, hit like, share which antacid you use, if any, and subscribe for more health insights. Stay informed, stay safe, Arcanites, strong and aware.